Today we are going to discuss about type 3 hypersensitivity reactions results due to the excess formation of the immune complexes. These type 3 hypersensitivity reactions is also known as Arthus reactions or immune complex mediated reactions. So this will initiate the inflammatory response to activation of complement system, which leads to tissue injury. Okay, exogenous antigens such as bacteria, virus will cause this, and endogenous antigens like DNA antigens which are involved in this. So ultimately there will be removal of the immune complexes, because these immune complexes will be recognized as complements, and these will directly phagocytosed by the macrophages, monocytes, or they are carried to the liver and the spleen, and where they phagocytose there. Okay, if there is excess dose of antigen, if we expose to the excess dose of antigen over prolonged time, in case of chronic infection or autoimmune diseases, or repeated exposure to environment pollutants, there will be excess formation of the immune complexes. So let's discuss about this types of immune complexes. Types of immune complexes, there will be soluble and insoluble immune complexes. Normally if there is a balance between the antigen antibody, then it will decide the which type of immune complex is forming. Okay, so soluble versus insoluble. If soluble means if there is more number of antigens and less number of antibodies, they will form soluble immune complex. Insoluble means if there are more number of antibodies and less number of antigens, they will form insoluble. Okay, insoluble. So they will tend to localize near the site of antigen administration. Okay, then what is this picture? We'll see here. There is a deposition of antigen antibody complex, and simultaneously these antigen antibody complex deposition is recognized by neutrophils, and neutrophil recruitment is occurring there. And we had already saw that these complements also will recognize these antigen antibody complex, which further are recognized by liver, spleen, and they will get phagocytosis there. Okay, then what is this mechanism of tissue injury? Normally classical complement activation will occur. So in the classical complement we will know they are C3A and C5A. Okay, C3A and C5A are vascular components. They are also known as anaphylatoxins. They will get released. They will increase the permeability of the blood vessels. Okay, these C3 and C5 are also known as chemoattractants. They recruit the neutrophils at the site of the immune complex. And what is the ultimate role of neutrophils means they will produce large number of lytic enzymes, and they will cause lysis, and platelet activation will occur. Immune complexes will they will get deposited on the Fc receptors which are present on the platelets, and they will help in adhering of the platelets. And simultaneously what will happen means there will be clot formation. And due to these vasoactive amines which will be released from the activated platelets, and there is clot formation. These clots will obstruct the blood vessels, leading to the tissue ischemia. Okay, into tissue ischemia, which further leads to tissue damage. And activation of Hageman's factor will occur. Activation of kinin, this will further leads to vasodilatation and edema. And there is coagulation pathways activation will occur due to this platelet activation. Okay, types of type 3 hypersensitivity reaction. One is localized or Arthus, and generalized systemic. Normally we will see localized or Arthus reaction, so that we will call this type 3 hypersensitivity reactions as Arthus reactions. So localized area of tissue necrosis will occur due to this vasculitis resulting from the acute immune complex deposition at the site of inoculation of antigen. Okay, Arthus reaction means if you inject the antigen to already sensitized animal like rabbit, then there will be formation of antibodies, right? These antibodies will get to the antigen, will bind to the antigen in the dermis, and these fix the complement, and localized immune complex mediated inflammatory response will occur, which is known as Arthus reaction. In humans, in skin, normally we'll see insect bites. Some insect bites we will see red color thing will occur. This is known as Arthus reaction. And during allergic desensitization treatment, lungs, if we inhale some bacteria, fungi, and spores, proteins may produce proteins. If we inhale, these Arthus reaction will produce. Okay, in intrapulmonary lesions will occur. Okay, so it causes extrinsic allergic alveolitis. So in case of systemic type 3 reactions, there will be two phases. One is formation of small sized soluble antigen antibody complexes. Another one, it induces a inflammatory reaction. Inflammatory reactions are vasculitis, glomerulonephritis, and synovial membrane arthritis. Okay, synovial membrane disease. Connective tissue disorders, they will result due to the auto antibodies following the immune complexes with self antigens. In SLE, we will see there will be formation of antigens against anti-nuclear antibodies. Okay. So in rheumatoid arthritis, we will see antibodies will be formed against the human immunoglobulins, and polyarteritis nodosa also we will see self antibodies. So parasitic diseases from immune complex depositions and streptococcus pyogenes, post streptococcal infections, and leprae. Okay, we'll see this. Coming to some examples for these parasitic diseases, farmer's lung due to the inhalation of actinomycetes from moldy hay, and birds of Franchi's disease, inhalation of serum proteins in the dust which is derived from the pigeon feces. Some famous personality also died from this inhalation of birds feces. Okay, pigeon feces. Okay, in viral diseases, hepatitis B, hepatitis C. In these cases, we'll see this arthritis, uh, infectious mononucleosis, which is caused by Epstein-Barr virus, and dengue. In dengue, we'll see these Arthus reactions. Okay, and serum sickness. Serum sickness. What is meant by serum sickness? Serum means after serum therapy, administration of horse. Suppose example, administration of horse anti-tetanus serum to treat tetany diseases. Some horse serum proteins, they are foreign to our body, right? So they will induce the antibody formation in the host, leading to the immune complex formation. After 7 to 8 days of serum therapy, will get the serum sickness. Symptoms are fever, weakness, vasculitis, edema, erythema. Rarely will see lymphadenopathy and glomerulonephritis. Okay, that's all for today. Today we discussed type 3 hypersensitivity reactions. If you like this video, like the video. Okay, thank you guys for listening to me patiently. Okay, thank you.